So what are the 3 common worries after blepharoplasty surgery, but actually you really don't need to worry? So all my patients after blepharoplasty surgery have my number for any concerns, particularly in that first week. I don't really hear from my patients until day 7, but it's more reassurance that they have my number if they are concerned. So worry number 1, why is one eyelid more swollen than the other in the immediate post-operative period? Well, I always say that everyone heals differently, even from arm to arm if we were to injure our arms, and even from eyelid to eyelid. It doesn't mean that there's been a complication, it doesn't mean that more surgery was done, it's just the natural response to the way your eyelids want to heal. The second worry is, will I have blurred vision? So I say to my patients, the operation is done safely and my primary concern is preserving the function of the eyelid and ultimately maintaining eyesight. However, you can sometimes have blurred vision in that first week after surgery. Don't worry, it's just the antibiotic ointment. All my patients go home with an antibiotic ointment to use in the eye and on the eyelid incisions themselves. This is a very important ointment because it keeps the eye lubricated, particularly at night, and it also helps prevent infection. But it is also a little bit like looking through Vaseline, so your vision will be misty, particularly in that first week when you'll be needing to use the drop more frequently. The third common worry is, I've got my eyelid wet, I've got the surgical site wet, what do I do? Don't panic. When you leave the hospital, you go home with all the medication that you require. In your bag, there'll be some gauze, so all you need to do is boil a kettle, let the water cool down, use the gauze that we're given, and just gently dab and wipe the eye area, and it'll be absolutely fine. So there are my 3 points that you don't need to worry about after blepharoplasty surgery.